warm up. Now I come down to the ground, or almost the ground. You could come to the knee, or even the hip. Or start with the hip. Slowly move to the knee. And then eventually get down to the foot. Real important. Follow the ball with your head. Okay, we'll go to the other side. Let's start with the hip. Now, if you had someone that had a problem, like a degenerative hip, or sprained ankle or something, and they couldn't stand, you could do this on the ball. Or they could sit on the ball, and then do these same motions, slower. Now remember, if somebody's really tall, and they're trying to match the same speed, and you're much shorter, they're going to have to work a lot harder to slow the ball down. So keep that in mind. Just because the guy's big, remember this ball's moving. Speed. It's not the weight of a bullet that kills you. Okay, we're going to do circles now. So this multiplanar activity, you reach, lunge. I call this scooping water out of a river. Nice and slow. Clients will tend to not bend their knees. If they don't bend their knees, they'll put a lot of stress on that back. Now normally I do 15 to 25 reps of each of these movements. I don't know, I've been probably doing about 10 now. Okay, that's your dynamic warm-up. We're going to start a series of floor exercises. There's some things you can use as a feedback mechanism. Sometimes you can take a blood pressure cuff and stick it right under the belly button, which would be like your L3. Okay, and then fill it up to about 30 pounds of, what is it called? Just 30, whatever, grams or whatever. I can't remember at the top of my head, but you'll see on the dial 30. and then have them press into it a little bit, which should raise the pressure to like 60 or 70 or whatever it is. It shouldn't be a bump under the back. It should just be kind of flat or just almost like a support to their back. You're not going to blow this thing up so they got a bump in their back. And then when they lift their leg, you can see if the pressure gets less. Because if they don't have lower abdominals or abdominal stabilization as they lift their legs, then their back will arch, right? So what you want to do is you lay here, kind of draw your belly, your umbilicus, belly button in a little bit, and then slowly lift your leg. Okay, this is for people who have pain, you know. Now, if this causes pain, you got to stop, but this is very slow, okay? It's not this. It's not that. It's slow. Okay? Slow. They lift their leg, opposite arm. Okay? Now, as they get stronger, lift their leg and extend their leg. Right? Straighten it out. You can't really see that, but you can imagine it. Okay? All right. Now, what I do sometimes is I extend the leg and then abduct the leg slightly. All right? So it puts a little bit more challenge to the obliques, all right? Which also helps stabilize the lower back. Remember, the internal oblique also attaches to the thoracolumbar fascia. Okay? So you can add the arm, which helps counteract that weight on the leg. Okay? And that's the beginning of the easy ones. Okay, let's progress to make them a little harder. So now we can bring the heels towards the butt, draw the belly in slightly, and then bridge up. Okay? So you can start just with that. Firing the hamstrings. Remember, we're going to work all the muscles that attach to the pelvis. Squeeze at the top. Nice and slow. Okay. Now once you held it here, you can hold it. For a client, you can put a dowel rod or something on here to make sure that they stay level. And then slowly draw in the belly button. Slowly lift one leg off the ground. You're going to feel your pelvis want to drop. Don't let it. Tighten the abs and come back down. Reposition if you have to. Slowly extend the leg. The key for this to me is slow. Everything's slow. Keep the belly button drawn in. Okay, now as before, you were doing both legs at the same time, hip extension. Now you're going to do it with one leg. Draw the belly in, lift the leg, and then up and down. I'm just going to do 5 reps each so that the tape doesn't get too long. I actually have arthritis in my lumbar spine, so it's good for me to do this as well. Okay? Now we can progress to dead bug. That's what it looks like if you sprayed a bug with rain. So draw the belly in, lift the legs off the ground, start with, see my knees are over my hips. Okay, and bring your hands, you can keep them over your shoulder. This is the first, the easiest one. And slowly extend. Now, again, you don't want their back to arch. So, they got to tighten their abs. You can have them stick their tongue in the roof of their mouth and slightly lift their head. So it's kind of a crunch. And then you can just have them time it here and hold it. A good time is 2 minutes. That's a real good time. Decent time is a minute. You can have them pulse as well, like this. And you can also have adduct, just like you did before. Opposite arm, opposite leg. Okay? So for me, I get a little bored doing this here, so I do things to stretch my adductors. Bring it back. Stretch. Bring it back. Keep your belly button in. Pulse. Slowly.